Many kids are headed back to school this week across the country. Many are already in school. So how to best set up your family for health and success in the months ahead? Our medical correspondent, Dr. Darien Sutton, is here with the fall family checklist. Dr. Sutton, good morning. It's always great to have you. So first, you have an important reminder about health checkups and vaccines.
Yeah, well, this is my favorite time of year, going back to school. As you know, I spent most of my life in school, so of course it is. So remembering to get these vaccines done, I think it's so important to make sure that you get checkups, not just for the children, but for parents, reminding parents to get that checkup, that yearly checkup. It helps with prevention. And then vaccines, of course. They help build our body's protection, help lasting protection for a long period of time. Right now, we have the updated COVID vaccines available for those who are 6 months and older. And remember, you can get COVID vaccines as well as flu vaccines at the same time. And while we're on the topic of vaccines, it's important to remember the other vaccines that we do to protect children against these infections. Under the age of 7, at least 7 vaccines are available. So making sure that you're checking with your pediatrician to make sure that your child is up to date on these vaccines, especially as we move into the colder months and more infections like flu, COVID, and other common colds.
And we were just talking during the commercial break about our sleep routines, right? And when you have back to school, obviously you have school activities, things change. So how do you get those schedules in check?
Well, number one, understanding the importance of sleep. Sleep helps us with academic performance, with brain performance. It improves mood for children, so decreasing those tantrums, making sure you remember.
And adults.
And adults. And adults. That's a really key important part.
Stomps his feet.
Making sure you're hitting on those important time points. So for teens, for example, 8 to 10 hours. I think most importantly, the reminder for children, 10 to 14 hours. So it's important not only to get that sleep, but also being consistent, not only during the week, but during the weekend. You want to wake up and go to sleep around the same time.
Could you tell my kids they need 9 to 12 hours? I just saw that
I
on
will
there.
bring that for you.
By the way, you mentioned activities. We have soccer, football, all these things.
Yeah.
So you either eat dinner at 4 o'clock or 10 o'clock, and a lot of times you can't do family dinner. How do we keep our diet in check?
Well, one of the tips that I found out from a fellow parent was having dinner as soon as children get home. I think that is fascinating and a good idea. Number one, because I remember how starving I was at the end of the day. So I think also involving children in food preparation, switching from unhealthy fats like butter to healthy fats like olive oil, teaching children how to read food labels and being mindful of added sugar. Remember, it's only recommended that we get at least 25 to 35 grams of sugar a day. That can be found in a bottle of juice or a bottle of soda. So being cognizant of that is really, really important. And then something I think is helpful to try out this year is walks after meals. They have been shown to improve our outcomes in terms of managing our weight, improving our health, and overall sleep at the end of the day. And so I think one good activity this year to start is walking after that meal.
That's great advice. Love that. Thank you, Dr. Darien.
Of course.
As always, you have the best
Favorite time of my year.